So in the last part of this section on measurement, I want to discuss concepts with respect to the quality of measures. Now here we're interested in how accurate, valid, and precise a measure is, and I'll go into each of those now. First is validity. Validity is the degree to which a variable you are measuring actually accurately measures the phenomena that you are interested in. And there are various kinds of validity. I'm going to discuss some of the key ones that we consider in FE regularly now. The first is face validity, which is how well does a measure work based on intuitive judgment? Does it make sense that it should be measured the way that is being measured? This is more of a qualitative measure, and it's largely driven by what's known in that field. And hence it's also more subjective than perhaps some of the other measures of validity that we are also concerned about. Now, sampling validity asks us how well does the measure represent the aspects of the phenomenon that you are interested in. So for a good example is the time to run 1 mile a good measure of cardiovascular health? And again, that could be discussed or debated depending on the research question. The next concept is construct validity, and this is asking how well does the measure conform to our current theoretical models or concepts of the phenomenon. There are some examples I'm giving you here. Which biomarker is the best estimator of levels of smoking? And interesting about construct validity is it obviously the validity of a measure, the construct validity of a measure can change over time as the quality of information about that particular disease can change. So with respect to, say, smoking and the ability to measure levels of smoking in an individual, what we used to use as a valid measure, say 50 years ago, is clearly different than what we use today, because we have more advanced technology today that allows us to look at factors at a much more molecular level. Then there's criterion-related validity. The first is correlational validity, which asks, does the measure that you're collecting correlate well to the widely accepted criterion or gold standard? So for example, does your self-reported stress scale correlate with other known measures of stress? So correlational validity is a useful measure of validity to consider in any measure that you're collecting, because it allows us to draw relationships or associations with other factors or measures that we know predict the disease or the outcome that we're studying. So another example is, can your assay for viruses produce the same result when you use it with a test versus when you use it to test a known amount of virus? So you know that there's a specific level of virus that was collected and measured in another way. Can that new assay or that other assay provide you with the same level of result? Again, that's a nice example of correlational validity. Predictive validity is the ability of the variable to predict the outcome. An example is, does your depression index score predict your risk of suicide? Do levels of serum tumor marker predict cancer reoccurrence? In order for a measure to have predictive validity, it obviously needs to undergo prospective and longitudinal assessment. The next is convergent validity. And this is the idea that does the variable have acceptance based on multiple lines of evidence? So here's a good example of LDL cholesterol. This is a measure that has convergent validity because it has been validated to measure the risk of arteriosclerosis by histopathology, epidemiologic studies of population and family level data, animal models, and interventional studies. So yes, a truly valid measure with convergent validity. So next I want to talk about accuracy and precision. Accuracy is the degree to which a variable agrees with some reference or gold standard, as well as being free from any systematic error, or which is otherwise known as bias. We will discuss bias in much, much greater detail in a subsequent module, but bias is something that we always try to eliminate or reduce as most as possible, And as it's stated here, it's some systematic error that's introduced either in the measure or the design or interpretation of some sort of study outcome or measure. So again, accuracy. How well does that variable that you're measuring correlate with the gold standard? And then precision is how reliable a measure is, otherwise the degree to which the variable can be reproduced, as well as can be, and so it's thus free of what we call random error, which is just error that happens with repeated measures. However, the random error can be reduced greatly if there's a measure that's accurate and valid. These are all all these terms are related to each other. And so here is a kind of a way to think about the relationship of precision and accuracy. And this is thinking about it in terms of target shooting analogy. So in this first example here, you see the clustering of the shots, suggesting there's good precision. They're all tightly connected to each other or close to each other, but the accuracy is poor. So that has so a measure that's precise, but unfortunately inaccurate. Down here you have a measure that has some accuracy because it measured the center, but it's not precise because of the variation in the values. This is what we aim to achieve, and that is a measure that's both precise and accurate. And then this is when we have neither occurring. Now, the approach to selecting a good measure, well, this is a topic that could be a course in itself. But essentially, these are kind of the general concepts, and that the first being that we attempt to choose standardized measures that already have established validity if they're available. And what I'm talking about is when we decide to do a study, we hopefully will utilize something that already exists. However, that isn't always the case, right? So sometimes we have to develop a measure as we go. And how do we do that? Well, we first consult with experts in that field to understand what it is we need to measure and ideas around what would represent the best way to measure the outcome that we're interested in. We also then would need to pilot that measure, and in that we're implementing it in a small study approach to determine early on some assessments of validity, accuracy, and precision. And then that would be further tested in a more large study setting. And then along that process, we're always needing to collect data on multiple factors to ensure that all the measures are being considered, really for that goal of looking at convergent validity. So that's just a summary of kind of the key considerations for selecting appropriate measures.